How does catastrophic coverage work in Medicare Part D? Imagine reaching a point where your prescription drug costs suddenly drop to zero. That's what happens during the catastrophic coverage phase of Medicare Part D. This part of your drug plan kicks in after you spend a certain amount out of pocket in a year. Starting in 2025, that amount is set at $2,000. Before 2025, it was higher, and there was a gap called the donut hole where costs could be quite steep. Now, once you hit that $2,000 mark, Medicare covers all your covered medications for the rest of the year. You won't pay anything for your prescriptions during this phase, which can be a huge relief if you need expensive medicines. Getting to this point involves going through earlier stages. First, you pay the full price for your drugs until you meet your deductible. In 2025, that deductible cannot be more than $590. After that, you enter the initial coverage phase, where you pay co-payments or co-insurance until your total out-of-pocket spending reaches $2,000. Once you hit that $2,000 limit, you move into the catastrophic coverage phase. During this final phase, Medicare takes on the full cost of your covered drugs. Previously, you might have paid about 5% co-insurance, but thanks to recent changes, you now pay nothing. This means if you need costly medications, your expenses are greatly reduced after reaching that $2,000 out-of-pocket threshold. It's important to note that costs are shared differently in this phase. Medicare's portion decreases, while Part D plans and drug manufacturers cover a larger share, helping control overall program costs. There are programs like Medicaid, Extra Help, and state pharmaceutical assistance that can help you spend less on drugs and reach this phase sooner. These programs can count toward your out-of-pocket spending, making it easier to get to the point where Medicare covers everything. In summary, once your out-of-pocket drug costs hit $2,000 in a year, you enter the catastrophic coverage phase. From that moment on, Medicare pays for all covered medications, eliminating the coverage gap and easing the financial burden for those who need many or expensive prescriptions.